This is the nasal medication administration skill video. So I would check my MAR at the med cart or whatever the facility uses to store medications, whether it be med room, med cart, etc. I would check that it's the right patient, the right medication, the right dose, and I would prepare it at the med cart as needed, and then I would knock on my patient's door, explain to them the procedure, ask if I have permission to do so. I would then shut the door, pull the curtain to provide privacy, and excuse me, I would wash my hands and put on clean gloves. And so I would position the client correctly, which with drops, I would assist the client to sit down or lie down with their heads slightly tilted back. And be sure not to have the client tilt their head too far back to avoid neck injury or neck pain. And then with sprays, you would have the client sit upright. I could warm the nose drops by holding the bottle between my hands for a few moments before giving them to the patient. I'd put on clean gloves, administer the correct amount of medication, which was listed on the MAR, administer the drops, put in the ordered amount of drops into the nostril, and instruct the client to stay sitting or lying down for a few minutes so that the medication stays in their nose and doesn't fall out. And then with a spray, I would administer the ordered number of sprays, spray quickly and forcefully squeeze the bottle while the client sniffs in. I would instruct them to sniff as I'm spraying the nasal spray into their nose. They can do it themselves if he or she is able. Then I would wipe the dropper or the nozzle with a tissue and replace and tighten the cap. I would store the medication bottle according to agency policy, and then I would remove my gloves and discard of them, and wash my hands, and then return back to the med cart or wherever the medication is prepared and stored, and document the correct documentation that I administered the nasal medication, the right dose, etc. Or if they refuse that medication, I would document a refusal.